Good morning. Good morning, dear colleagues, dear friends. Welcome to this meeting. I'm very pleased to open it. We have visitors from outside the United Nations this morning, and we took a bit of time to allow them to come, and we're still waiting a number of them. My name is Cornel Feruț. I'm the ambassador of Romania to the United Nations. I'm very pleased to be here at this meeting. It's one of the rare privileges, I would say, in the United Nations to be able to connect such an important topic for many of our generations, and especially our youth, our children, with the work that we are doing here at the United Nations. And I was very pleased to be working together with a number of delegations across the globe. We have a geographical balance with Canada, with Indonesia, with Kuwait, with Mexico, Qatar, but also with WHO and UNICEF and the Youth Office. We've been looking at connecting and bringing together a very varied group of countries that could amplify that voice, that important voice that we want to share through this meeting, and also bringing the important organizations that are looking at this important issue, which is mental health of youth and children. And we will be hearing throughout the event from our colleagues. I'm looking at an event that will not be bureaucratic type of conversation. We'll be looking at something that would stimulate not only our thinking, but also our way ahead. I'm very grateful to the President of the General Assembly for being with us today. He has been a very strong advocate, and we'll be discussing about this matter couple of months ago at the beginning of this year. And he, all throughout the process, he has been a very strong and passionate supporter of this message that we want to share. We are very encouraged by the presence of Professor Andrew Solomon with us this morning. He is one of the highly respected professionals on mental health issues and the writer on mental health. I'm not going to reveal what he's currently doing, but I think he's doing important work and research on mental health, especially in youth and children. Now, what is the reason behind this event? I have to say that it was dictated by the reality. Every time we've been interacting with many young people, students especially, from all around the world, from all across the United States and Europe and other countries, they always want to discuss about our priorities as individuals, as countries. And whenever you put that question back, what are your key topics of interest? We always got the same answer: technology and mental health. And this acknowledgement that mental health is important is already creates a responsibility for us, for the policy shapers and policy makers, decision makers in governments, to be able to connect our agenda with this expectation and the issues that preoccupies the younger generation. I'm not going to be long. I'm just going to leave with you a couple of figures, which we selected very carefully, simply because they are the reality. So this is not just a random figure. But in doing our research for this event, we wanted to get a sense. We know that mental health in youth and children is important, but we want to get the magnitude of that problem. And I'm struck myself by the numbers. 1 in 7 10 to 19 years old people experiences a mental disorder. This is about 13% of the global burden of disease in this age group, 10 to 19. And in some countries, the reality is even more devastating. Depression, anxiety, and behavioral disorders are among the leading causes of illness and disability among adolescents. And suicide is the 4th leading cause of death among 15 to 29 years old. Specialists will elaborate further, but I think those figures are strong and powerful enough to determine proper consideration here at the UN by the member states. We will be hearing from the panel. We'll be hearing from the organizers. We will open the floor for comments and questions. So I would kindly ask you to prepare yourself. I want to acknowledge with us here the presence of one of the most distinguished advocates for mental health issues, Mrs. Uma Thurman, and we thank you for being here with us. This adds also to the voice and to the policies that we want to inform at the global but also national level. I would first give the floor to the President of the General Assembly. As I said, I'm very grateful to you, Mr. President, for your strong advocacy, and I'm very pleased to invite you to deliver your comments, please.
Your Excellency Cornel Feruta, Permanent Representative of Romania to the United Nations, Excellencies, delegates, distinguished guests, ladies and gentlemen. Allow me first to commend the Permanent Representative of Romania, on whose insightful initiative the impetus to shine a light on this extraordinarily important matter originated, and whose permanent mission, in conjunction with those of Canada, India, Kuwait, Mexico, and Qatar, is co-organizing this event alongside the World Health Organization, UNICEF, and the United Nations Youth Office. The entire General Assembly is in your debt for providing such an ideal platform to delve more deeply into the complex dynamics of this important issue of the mental health of children and young people, and to the very important question of how can we do better. I have used the descriptor extraordinarily important because of the rising numbers of persons generally choosing suicide, particularly people in the young age cohort, quite literally in the formative and most productive years of life, who evidently see suicide as a way out or a solution of some sort to some problem or burden they are carrying. And alarmingly, suicide is the fourth leading cause of death among people aged 15 to 29 years, pointing to a widespread mental health crisis. Moreover, despite the recognition of good health as a fundamental human right that should be universally accessible, mental health is often neglected, owing in part to the stigma surrounding it. The costs and consequences of such neglects are dire and often terminal. Globally, 1 in 7 people aged 10 to 19 are estimated to experience a mental health disorder at some point in their lives. Half of all mental health conditions begin before the age of 14, with 75% emerging by age 25. And yet, in many cases, remain undetected and untreated. This already staggering number is rising further, adversely affecting the ability of an increasing number of children and adults to learn, to work, to socialize, and to fully enjoy normal lives. Sadly, as is so often the case, the mental health crisis is exceptionally acute for children in conflicts and humanitarian emergencies. UNICEF estimates that almost all children in Gaza, more than 1 million, require mental health assistance and psychological support. This is an increase from the estimated 500,000 children that were already in need prior to the current conflict. Moreover, an estimated 1.5 million children in Ukraine are at risk of depression, anxiety, post-traumatic stress disorder, and other mental health issues due to the ongoing conflict. Similarly, children across the Sudan and Haiti are enduring shocking levels of deprivation of food, tragedy and trauma, suffering in silence, unable to access the daily nutrition and other care they so desperately need to survive. The long-term effect of such experiences on their psyche are unimaginable. Tackling mental health should not only be approached as a health issue. Promoting good mental health is also inextricably linked with respect for human rights and sustainable development. And we must collectively work across sectors to address the underlying determinants of health and well-being. Alarmingly, more than 80% of all people with mental health disorders live in low and middle-income countries, where a vicious cycle between mental health and poverty is prevalent. Averaging a mere 2.1% of government health expenditure, the global financing for mental health is already woefully low. But in developing countries, it is at, this is a real shock, it is at literally 8 cents US per capita, per person, 8 cents. For all practical purposes, therefore, it's non-existent. International development assistance for mental health is also scarce, with development assistance for children and adolescents being even more meager. Reflecting on the foregoing, we must do much more to meet the commitments we all agreed to in the political declaration last September at the high-level meeting on universal health coverage, adopted through GA Resolution 78/4. We must scale up our efforts to promote and improve mental health and well-being as an essential part of universal health coverage, including by closing the mental health treatment gap, which is estimated to be as high as 90% in some settings. Member states need to invest further in strengthening national health systems, multi-sectoral promotion and prevention, and community-based mental health programs and services. Moreover, they should leverage digital technologies to strengthen the capacities of the mental health and psychological support workforce, with particular reference to the education sector. We must also take deliberate action to uphold and protect the human rights of people living with mental health conditions and to eliminate the stigma and discrimination that they often endure. We must bear in mind the gender differences in mental health needs. This means being alert to women's specific challenges like perinatal mental health and their vulnerability to sexual and gender-based violence. And we must also ensure that children and young people are meaningfully involved when crafting mental health programs to respond to their needs. As we continue to engage on this issue, we must rely on the valuable guidance and support of the World Health Organization and of UNICEF. Further, we will continue to rely on the UN Youth Office in promoting youth engagement to advocate for these goals. I look forward to hearing from the eminent experts in the field, such as Andrew Solomon and Deborah Castell, and to a comprehensive discussion from all participants. And I hope that the following discussion will give impetus to the implementation of the General Assembly's first ever resolution on mental health and psychosocial support adopted last year. Further, I hope it will also serve as useful food for thought in the lead up to the 4th UN high-level meeting on the prevention and control of non-communicable diseases in 2025. And broadly, I hope it will help advance important conversations and efforts relating to the mental health issues and well-being of children and young people. I wish you all a very successful event. Thank you.
Thank you very much, Mr. President. You've looked at the issue, but I think you also addressed the part of the concept of the meeting, which is how we can do better. And of course, at the UN, we can build on the resolution adopted last year on mental health in general. But I think this is probably the first time when we are looking at the mental health of children and youth. And that's important because it could only motivate us member states to work together. I would like now to welcome our keynote speaker, Professor Andrew Solomon. He needs no introduction for most of you, but I'm going to introduce him anyway. As I said, he is probably one of the most respected voices on mental health issues. I think thanks to Andrew Solomon, probably we got to know and bring to the surface such an important, such a silent, enemy that many of us are facing. He's professor of clinical and medical psychology at the Columbia University Medical Center, a lecturer in psychiatry at the Yale University. I think you know Andrew Solomon through the books that he wrote. He's the winner of the National Book Award and an activist in mental health. His books, Far from the Tree, Parents, Children, and the Search for Identity, The Noonday Demon, An Atlas of Depression, Far and Away, Reporting from the Brink of Change, have received a significant number of prizes, but as I said, brought to the surface some of the issues that we as humans, individuals, are faced with, and sometimes don't have the courage to acknowledge it. And I'm very grateful to Andrew Solomon for being here with us today. He wrote extensively on mental health issues, especially including in children, more recently for New Yorker. He keeps lecturing on these important issues, and I find it quite a privilege for us to have such an authoritative voice in our midst at the UN and to be able to inform our thinking, our reflections. So, Andrew, I'm so pleased that you are here. I'm very glad, so I will now give you the floor, please.
Let me first express my thanks, Mr. Ambassador, to you, and Mr. President, to you. It's an enormous honor for me to be able to speak at the General Assembly. It's an enormous honor to be here with Deborah Kestel and to have an opportunity to address all of you on a topic that's very close to my heart. I can work to have insight in this area, but I cannot cause policy to change. And you all can. And it's deeply meaningful to have an opportunity to speak to you directly. The youth mental health crisis is worldwide. Two wrong-headed opposite perceptions dominate the public discourse. First, that the problem is one of privilege, not relevant to developing nations. And second, that it applies primarily to countries ravaged by war and famine. Neither assertion is valid. This problem, as the President just acknowledged, affects rich and the poor, wealthy countries and devastated ones, and the vast majority that lies in between. Addressing the problem of youth mental illness is important for young people in psychic pain and their families. It is equally relevant to everyone else, because youth mental illness is a poison that undermines the social order. Its financial cost is enormous. In societies where youth mental illness is accepted as unavoidable, it spreads and escalates. Even as we confront the other consuming problems of the world, we need to address the despair that is attacking every nation's youth. Because if we don't, we will find a ruined generation shepherding the world, and ruined generations do not bring about advancement. Their brokenness ultimately breaks everyone. In the American military, more soldiers have died by suicide since 9/11 than have died in action. What kind of preparedness can we have when even the warriors among us are dropping from despair? When I worked on depression among survivors of the Khmer Rouge in Cambodia with the remarkable Phali Nguyen, I heard that in the border camps, she was told that there were no resources for something as obscure as mental health, even as she saw young women dying, their children untended. In Greenland, south of Ilulissat, I worked in a settlement where a small group of women had introduced therapeutic dialogue, announcing one autumn that they were available to everyone. They were met with shamed silence, but by spring, every person there, young and old, had come to see them. In Rwanda, I interviewed women who had been raped in the genocide and the children who were the product of those attacks. And I saw how those youngsters, in many instances, both unwanted and loved, suffered their own mortification and rage against the humiliation and fury that were turned against them. In Japan, I spoke to hikikomori who had gone decades without leaving the house. In Somalia and Nigeria, I looked at the question of shackling people with mental illness, those accorded less dignity often than the farm animals with whom they shared their shelters. And in Senegal, I experienced traditional rituals for the treatment of mental illness that involved cleansing people of evil spirits, and understood very clearly the cultural specificity of any treatment model. Through all these constructions, I saw the same underlying issue, how a once obscure adult problem had become a commonplace among children and teenagers, and how the spread of mental illness among youth was threatening the future of every society on earth. The cost of treating mental illness is real, but what is impossibly expensive is the cost of not treating mental illness. People with mental illness remain outside the functioning economy by and large. They require lifetime care. They may be violent and destroy other people and property. Without a functioning mental health strategy, they may be terrible parents. They will require medical attention across their lifespan. Some will need incarceration in a hospital or a prison. They may revert to extremism, including terrorism. Prevention may seem like an extravagance, but compared to the cost of all this, it's negligible. You don't think it's going to happen to your own child until it does. As Chris Dawley, who lost a son to suicide, said to me, "You take care of your children and protect them. You make them wear seatbelts in the car. You make them go to school. You try to get them to eat right. You lock the doors every night, not knowing that the lion is already inside the house." We face escalating identification of mental illness and suicidality, and also escalating incidence of these problems. But we also have an escalating ability to treat them. Talk therapy, medication, alternative treatments, diet, exercise, and sleep, the feeling of security that comes with unconditional acceptance and support. In concert, these can be transformative. Attempts by Western experts to foist their solutions on other parts of the world are often impositions. But the notion that there are solutions is a profound, universal truth. Young people need fresh air, exercise, food, sleep, education, acceptance, freedom from stigma, and treatment, whatever it may be, for their mental illnesses. I have the good fortune to experience luxuries to which others do not have access. Many of the material comforts shared by the people in this room are unavailable to the general population. But as someone who suffered from mental illness in my own youth and who is now largely free of it, I do not accept that my mental health is a luxury, nor that anyone else's is. I do not accept that my children's mental health is a luxury. Yet in every society where I have worked, privileged people have better access to mental health treatment than economically deprived people do. I was saved by love and good treatment, but I was also saved by money, which should not play the determinative role. Having your mind function is not the dollop of caviar to brighten up humble food. That is a gross injustice. I recently spent time with Atiyah Grady, a brilliant black woman in Minneapolis who is now in her early 20s and who grew up in deprivation. When her brother Nicholas developed symptoms of psychosis, he was in denial. But after his second suicide attempt, he agreed to go to an emergency room. They had no psychiatric beds, but agreed to hold him until one opened up. After 8 days, without treatment, he was released because his insurance was out. And 2 weeks later, he killed himself. Does that benefit society? 8 days of non-treatment because he didn't have the money and wherewithal and perhaps the racial identity to secure the treatment that should have been his right? Atiyah was herself suicidal when we met. These young people had experienced abuse and deprivation, but Nicholas could have been a bright fleck in the world. How can we consign people to this suffering on top of the difficulties they have overcome? I promised Atiyah that I would tell Nicholas's story far and wide, and I do so not only because of that promise, but also because his story is occurring in every country, no matter what the structure of the healthcare system. It's hard for people who are unacquainted with these experiences to understand how a child can be afflicted with mental illness. We used to think children couldn't have this kind of agony and rage, but now we know better. The poet Jane Kenyon wrote, "When I was born, you waited behind a pile of linen in the nursery, and when we were alone, you lay down on top of me, pressing the bile of desolation into every pore. And from that day on, everything under the sun and moon made me sad. You taught me to exist without gratitude. You ruined my manners toward God. We're here simply to wait for death. The pleasures of earth are overrated. I was already yours in infancy, the anti-urge, the mutilator of souls." The world in general is better at responding to crisis than at preventing it. But much of youth mental illness can be averted, and most can be treated. The interventions required are less expensive than people suppose, and they more than pay for themselves. Yes, top quality care for serious illness can be costly, but a great deal of care can be delivered through educational initiatives, through basic training of parents and teachers and children in existing health settings such as vaccine clinics. Interviewing impoverished American women who had lost children to foster care, I found that while some were genuinely dysfunctional, most loved their children. They had grown up in dire circumstances and didn't know how to manifest that love productively. The cost of removing their children was far greater than the cost of teaching them how to care for those children. But the cycle of pity, in which we presume that people who fail as parents are morally inferior, leads us to break the children. Abusive parenting can come out of fierce rage, but it is more often a consequence of ignorance. And abuse causes more mental illness than any other factor. Some trauma is inescapable. The president referred to the situation of children in Gaza and in Ukraine, and what they are enduring at this moment. But trauma within families can frequently be redirected and contained. Giving parents basic information about parenting during routine healthcare encounters is surprisingly effective. Teach parents, and then teach children. Young people are lonely, far lonelier than many people realize. And the social abilities that most of us rely on are not necessarily obvious to them. So social isolation is a prime determinant of mental illness. If you teach 6-year-olds through a variety of games and rules how to listen, how to engage with one another, how to conduct a respectful conversation, you can lower the long-term rate of mental illness by half, and the rate of encounters with the justice system by almost half. These programs require teachers, often in groups, to go through a month of training, potentially online. The cost is negligible. A Libyan friend whose teenage nephew killed himself described how mental illness is associated only with incoherent ranting in the place where he lives. When he said that this young man must have suffered depression, the family insisted that he was a good boy, that he went to the mosque every day, that he helped his mother in the kitchen, and that there was nothing crazy about him. Suicide is complicated, but people do not in general kill themselves unless they are suffering. This boy was not sound of mind. Faith steers many people through their darkest nights, but it is often not enough when we have the capacity to intervene in so many other ways as well. The first treatment issue is identification. Children who are paralyzed, depressed, dysfunctional, even psychotic, may appear to be exhibiting an appropriate response to difficult circumstances. Mental illness can be treated and resolved even when it follows trauma. The source of the illness has nothing to do with how well it can be ameliorated. As in most of health, services go to people who request them. Young people don't generally understand the working of other people's minds, which means that they tend not to know when their own minds are not functioning normally. So they don't self-identify as having mental illnesses. If their parents, teachers, other doctors, or community caregivers aren't aware of these conditions and what the signs are to look for, then no one realizes that a child has a problem until that problem has become entrenched. So no one asks for treatment, and treatment is not provided. Basic public education of parents and teachers, and ideally of religious leaders, health workers, and others who may have regular contact with children, can lead to early detection. Early treatment is more effective and less expensive than later treatment. Children are secretive. I once asked a close relative whether he ever felt suicidal. "No," he said, "but if I were, I wouldn't tell you." Depressed adolescents hide their problems from adults. Caretakers need to learn that if you ask a child whether she feels depressed and she says no, that doesn't necessarily mean she isn't depressed. One approach to children has to be different from our approach to adults. The British psychiatrist Alexander Shan said, "Everyone the parents know has a microwave. So they borrow the instructions and push all the same buttons everyone else seems to be pushing, and they cannot understand why they don't get the same results. The problem is that they've given birth to a tea kettle. They cannot, and that pushing the same microwave buttons isn't going to get them anywhere. They cannot understand that. You explain it 50 times, and they're still telling you what their parents or friends did, what the parenting book said. Mentally ill children are different. And most children are dealing with some form of difference, whether they're mentally ill or not. The mainstream is, in fact, a small minority. They are LGBTQ, they belong to a racial minority, they have a disability, they are immigrants or refugees. Lack of acceptance can be such children's primary trauma. Families and communities must accept mental illness itself. Fear of labels exacerbates the problems they mark. Stigma poisons access to care. In its face, those who suffer learn neither how to fix nor how to tolerate their condition. Shiv Kulkarni began to sink in early adolescence. His parents, recent immigrants from North India, had no experience of mental health services. His mother, Shilpa, well-educated and accomplished, told me that to the best of her knowledge, she had never known anyone who had been to a therapist. She knew there was therapy out there and pursued treatment. But it is hard to start learning when your child is already in trouble. There is confusion about what constitutes good treatment, and there is misinformation all over the internet. Shilpa and her husband Vishnu were not opposed to or frightened of treatment, but they had to overcome the resistance to the idea that had been in their upbringing. Their efforts were nothing short of heroic. They are adoring parents, ready to do anything for their son. Like many immigrants and refugees, they have had to learn a new system, which is very hard to do. Despite therapy, Shiv died by suicide at 14. When I met the family, Shilpa invited me to dinner. When I got there, I was overwhelmed by the delicious smells and the dozens of pots. Her daughter said she hadn't seen her mother cook like that in ages. And I said, Shilpa, you didn't need to go to so much trouble. And she said to me, I wanted to make all of Shiv's favorite dishes one last time. Later in the conversation, I tried to assuage her sense of guilt. I told her she had done a remarkable job as a mother, and I described stories of abuse and horror that had been related to me by people who were struggling. Yes, she said, but those boys are still alive, aren't they? The Kulkarnis have now founded an organization, Shiv's Third Eye, to help educate their community about mental health care, to save other lives, since they are too late to save their son. The question is not whether youth mental illness is underreported, but by how much it is underreported. Youth suicide and mental illness has been going up, albeit erratically, since the 1950s at least. Identification is still very inadequate. The escalation's causes include the rise of the internet and social media, the proliferation of choices beyond what people can handle, the increasing visibility of the wealth gap, poverty, climate change, the decline in faith, the rise of autocracy, and so on. I could list these things for the next half hour. But the question of why is less important than the question of what we can and should do about it. The internet can be dangerous. It can also be helpful. Older people may rationally reach the point of giving up, but there is no reason for children to do so. Alison Dewson, whose son suffered terribly, said, each problem is a layer, and the illness sets in when there are, let's say, 15 layers. If you can get it down to 14, your child might be okay. There are many layers you cannot change, but if you target the ones you can, your child will then be able to deal with what's left. Norma Nazario, a Puerto Rican single mother here in Manhattan who worked multiple jobs, lost her son Jack, who had shown withdrawal and depression, to train surfing, and she has become an activist. And when we spoke in her apartment, she described anguish in a very measured voice. I finally asked her whether she still felt the sadness she was narrating. She broke down momentarily, then explained, anger is activism. It is how I cope with the world. Sadness is something I allow myself only in this apartment, because if I let the sadness well up, it would paralyze me, and then I couldn't do the work I need to do. Anger lets me confront the problem that sadness demonstrates. The question may be not why so many children are struggling, but why so many are not. Is it possible that existence is our exile and nothingness our home? The Romanian philosopher E.M. Cioran asked. The world is riddled with problems, yet most of us go about our lives with some cheer. People whose situation looks desperate go to amazing lengths to stay in the game. But these children may be canaries in the coal mine, pointing toward existential dread. The opposite of depression is not happiness, but vitality. One of the core signs of mental illness is collapse in the face of what is wrong with one's life and the world. And one of the core signs of mental vitality is seeking to change what is wrong. A society of people fixing their own and the world's problems is headed for success. A society of people who have given up is a society of failure. There is a moral onus to alleviate the suffering of people who are in terrible pain. But even if we don't cleave to that imperative, we should address the ubiquitous assault of troubled youth. We can do a great deal about it, and we're doing almost none of it in the developed or developing worlds. I'll conclude by telling you about Zach Matthews, who survived shooting himself through the neck last year. When I met him in September, he was almost entirely paralyzed, physically and mentally. In his school in Alpine, Utah, 22 people had died by suicide in the previous years. Do not doubt the spread of this crisis, nor the way it had normalized suicide as a reasonable way to cope with problems. He told me almost resentfully that he had tried as hard as he could to die, and that he was now too physically compromised to try again, and would have to make a go at being alive. I saw him again in January. He had made remarkable progress through sheer determination and could even with effort manage to walk, albeit limpingly. What I did hurt my mother, he said, and now I have to apologize. And you can't apologize for almost killing yourself by just saying, sorry, I won't do it again. My family was so glad I survived, whatever my condition, and I had to learn to be glad too. The only way I can apologize is by being happy. I thought at first I could just seem happy, but I realized that isn't enough. I have to be happy. Now, I'm like a toddler or something. You know how you see them taking their first steps and being proud? But they grow up and don't remember. I took my first steps after I thought I never would again. I climbed the stairs. I even felt proud when I figured out how to pick my nose. If I had died, my family would have been miserable for the rest of their lives. And because I lived, they are not. So the least I can do is be happy too. Maybe be the happiest one of all. It's not as hard as I thought. As the Bhutanese have recognized, gross national happiness has great value. Indeed, it is the necessary precondition not only to gross national product, but also to a habitable world. It lies within our reach. Failing to grasp for it is a hideous, but at the moment, strangely universal mistake. Thank you.
Well, one needs to pause after such a very powerful, I would say, exposure that brings into the conversation the right parameters for that conversation. And I'm deeply grateful to you, Professor Solomon, for going beyond or below the surface. We'll still be reflecting on the comments that you're making today. And I invite you as well to react to what Professor Solomon has said when we will engage with the room. As I mentioned earlier, WHO has been a very strong supporter of this effort to bring this important issue of mental health of children and youth and young people to our political debates. And I'm very grateful for WHO. I'm very grateful to Dr. Deborah Kestel that came from Geneva for this important meeting. She's the director of the Department of Mental Health and Substance Use. She's a senior global mental health policy expert with more than 30 years of international experience. Again, one of the strong professionals in policy making and policy shaping and assisting member states. She's been working extensively in Europe, the Caribbean, and Latin America. And she's been implementing and advising governments on policies related to mental health systems. Not only that I'm looking forward to your comments or your presentation, but of course I'm also looking forward to how we, member states, could relate much better to the important work that WHO is doing in Geneva and elsewhere. So, Mrs. Kestel, please, you have the floor.
Thank you very much, and thank you for the government of Romania and other governments involved for having organized this important initiative. Thank you very much, President of the General Assembly, for joining us, which gives us a clear message of why this is important for the UN and not just a health organization. And of course, thank you, Professor Solomon, for such a wonderful message. Very hard for me to speak after this passionate and comprehensive, but you know, I'm the World Health Organization here, so my message is more perhaps concrete and precisely perhaps answering to what Ambassador has said, what member states, what countries could do, should do. And I think that it is clear, I'm sure it was clear for all of you, that's why you are here, but right now, after the speech, very clear why protecting child and young people's mental health is a public health priority. And therefore, it's a shared responsibility, not just of the child or the youth, not just of the family, not only the health sector or child organizations, but of everybody else. We heard the numbers. I'm not going to repeat them, although most of those numbers come from my own team and the efforts of the colleagues that try to put that precarious and limited available data together, because that's also a big issue. We do not know exactly the dimension of the problem, but we know that most kids and young people will have a mental health condition at some point. We know that suicide is extremely high. And I'm always a bit amazed trying to understand how come that's not a strong enough message to promote reaction from those who can intervene to stop those deaths, to prevent those deaths, to stop those tentatives to happen. As already mentioned, addressing then the mental health needs of young people requires whole of society efforts and engagement for sectors that are beyond health, including education, social welfare, youth, sports, and justice, because everybody needs to improve policies, environments, and societal norms. It also requires a life course approach with a focus on promoting healthy behaviors and ensuring access to quality, affordable mental health care for all, from preconception and then during childhood, adolescence, and beyond. Member states, countries' awareness and demands on child and adolescents' mental health are at an all-time high. However, across the regions, majority of children with mental health conditions do not access care. inadequate financial allocation, and I was perhaps smiling a bit when President of the General Assembly was so surprised by such a low amount of money that is right now allocated to mental health care. It is extremely low, and on top of that, stigma and discrimination, and then the huge gaps in trained healthcare providers are among the major barriers for that lack of care for children with mental health conditions. In the health sector, for example, fewer than half of the member states, of the WHO member states, have any plan or strategy for child and adolescent mental health care, even now, when this is so clearly a priority for many. And far fewer than that have an adequate supply of trained health personnel. We estimate that there are just 3 mental health workers of any kind available for children and adolescents per 100,000 population. 3 per 100,000. We heard that 1 in 7 have a mental health conditions. We heard suicide is the fourth cause of death in children and adolescents. So 3 people taking care of that. Then the greatest challenge for society is how to optimize the conditions in which all young people can thrive, with at the same time responding to those with particular needs, social, educational, or health-related needs. There are many opportunities to meet families and young people where they are, and to make information and services available in ways that respond to their specific and evolving needs. We heard why this information is available just now. So let me share with you 5 concrete examples of what could be done. 1, integrating mental health into general health services is feasible, is affordable, and is cost-effective. Brief assessment and care for emotional, behavioral, and neurodevelopmental conditions in children and young people can be delivered at primary care, in community-based early childhood development centers, in youth health centers, in disease-specific services such as HIV/AIDS, or in general hospitals. A second one, integrating psychological interventions by non-specialists in maternal health services. This provides a unique opportunity to intervene early in perinatal mental health conditions, which affect 1 in 5 women globally, and obviously have adverse effects on the health, development, and well-being of their kids. 3, parenting intervention is another one. Parenting intervention can impact cognitive, language, and socio-emotional development, can reduce child maltreatment, and improve mental health outcomes for children and young people. Thank you. 4th, school-based social and emotional learning programs are among the most effective promotion strategies to improve students' emotional well-being, academic performance, prevent depression, anxiety, suicide, harmful substance use, and antisocial behavior. Beyond promotion, these settings also are good platforms for delivery of brief psychological interventions for young people with common mental health conditions. The last example is, thank you so much. The last example is workplaces. That workplaces offer opportunities for mental health promotion and protection, and for inclusion and participation of youth with mental health conditions through supported employment programs. In summary, investing in children and young people's mental health means investing in strategies to ensure access to effective, quality, affordable mental health care, tackle stigma, discrimination, and abuse within the health system and beyond, and address underlying social and economic realities that shape young people's mental health. Working to transform children and young people's mental health requires financial and support, and the strengthening partnership is also part of that and is needed at every level, including with persons with lived experience. A good example that I'm sharing with you here is the UNICEF-WHO joint program on mental health and psychosocial well-being and development that works trying to promote country-level partnership for the implementation of multi-sectoral plans for child and adolescents' brain and mental health, and right now is being implemented in 13 countries. In 2023 only, over 3,150 healthcare staff, teachers, and community workers were trained thanks to this initiative. An example from Albania, the joint program supported workforce strengthening efforts, which expanded access to mental health care across 3 geographic areas to more than 350,000 people. A drop in the ocean, but still, we need much increased investment and partnership for sustainable change and to achieve social inclusion and universal health coverage for child and adolescent mental health. To really conclude, this area is also receiving attention, increased attention in recent past mental health ministerial summits, and we expect that the same attention will be included in the coming mental health ministerial summit that Qatar is hosting next year, and perhaps by then there are more concrete examples from many more countries that we can present. Thank you very much.
Thank you very much, Dr. Kestel. And of course, this will not be the end of the conversation. We'll continue working together with you, and we appreciate your support. There are a number of people that are watching this event live. We are very pleased, as I said at the beginning, to have with us many advocates, civil society, researchers, and that's very much important. There is someone that wanted to be here but couldn't make it in such a short time. I would like to follow a message because she gladly accepted to send a message for the meeting, a message from Mrs. Cynthia Bisset Germanota, who is the president of the Born This Way Foundation, which she co-founded with her daughter, the very well-known artist Lady Gaga, in 2012. Under her leadership, the foundation has connected with tens of thousands of young people across the country and in the US and around the world. They launched innovative youth-focused programming and conducted cutting-edge research to improve the understanding of mental wellness. Since May 2019, the WHO appointed Cynthia as a global Goodwill Ambassador for Mental Health. So that's important to know that there is such an instrument as well. So I would like to invite you to watch this short video message.
Good morning to you all. I'm deeply honored to speak with you today as a WHO Goodwill Ambassador for Mental Health. I'm grateful to each of you for attending this conversation and for your commitment to joining us in advocating for the well-being of young people globally. In my journey as a youth mental health advocate, I've had the profound privilege of connecting with young individuals of distinct backgrounds across many regions. Through these conversations and the research led by those of us in this field, we know this generation prioritizes their mental health. Yet many express concern about the lack of accessible resources and support in their communities. Amidst these challenges, I find inspiration in the unique approach of individuals like Mariana Ogario, who, despite facing limited resources in her native Mexico, has tirelessly worked to bridge the gap in mental health support, highlighting the importance of language accessibility and cultural representation in mental health services. Stories like Mariana's highlight the urgent need to bridge this gap. Young people have expressed a strong desire to be actively involved in the development of initiatives, programs, and research intended to support them and reflect their needs and experiences. They understand that mental health is health. Today, I want to emphasize the pressing need to broaden opportunities for young people to receive help within their own communities, schools, families, and familiar environments. We must work together to prioritize creating pathways for them to access mental health support in their virtual and in-person communities. I'm grateful to the WHO and UNICEF for highlighting this important topic today and for developing resources to support the integration of socio-emotional learning in schools. I encourage each of you to learn more about the resources WHO and UNICEF have made available, including the Helping Adolescents Thrive Toolkit, The toolkit is available freely online and includes a core set of evidence-informed strategies to promote and protect adolescent mental health. Resources like these can help create a culture in communities where access to mental health services becomes an integral part of a young person's growth and learning trajectory. Investing in resources and including youth insights and perspectives is invaluable in shaping solutions and is crucial for addressing our world challenges, including mental health. In closing, I want to express again my heartfelt appreciation for your dedication to the mental health and resilience of young people everywhere. I wish you the best on today's discussions, and I look forward to contributing to the next steps in our collective efforts to support mental health. Thank you so very much.
Well, thank you very much, and I would like to thank the President of the General Assembly for being with us. I think you stayed longer than initially planned. There are so many other engagements to attend to, and I want to express our gratitude. And I know that the President of the General Assembly will continue to be the same very strong advocate as we move forward. Thank you very much, Mr. President.
Thank you very much.
So we continue now with comments and contributions from the floor, but I want first and foremost to give the floor to the co-organizers of this meeting, together with our mission. As I said, I'm very grateful to the delegations of Canada, of Mexico, Indonesia, Kuwait, and Qatar. And just because of that, I'm going to give you the floor first. So please, our colleague from Qatar, the Deputy Permanent Representative, would be having the floor, and then I'll give the floor to Canada. Please.
Thank you very much, Mr. Ambassador. Excellencies, ladies and gentlemen, it is an honor for the State of Qatar to co-host this event alongside Canada, Indonesia, Kuwait, Mexico, Romania, the World Health Organization, UNICEF, and the United Nations Youth Office. We extend our gratitude to the President of the General Assembly for his insightful opening remarks and appreciate the contributions of all other esteemed speakers. The State of Qatar firmly believes in the importance of the mental health and emotional well-being for children and adolescents. Good mental health is crucial for allowing our young ones to develop resilience, cope with life's challenges, and mature into well-rounded health adults. Yet today, I'd like to highlight some of our efforts from the perspectives of policy and health, collaboration, education, and technology. First, in our National Health Strategy 2018-2024, we have prioritized the improvements of mental health and well-being, achieving a significant advancements in service accessibility, stigma reduction, and the development of integrated care systems. As we prepare to launch our third National Health Strategy later this year, our commitment to enhancing mental health care, leveraging both existing and new technologies for more accessible, integrated, holistic care remains steadfast. Second, we are harnessing digital platforms to facilitate virtual access to services, support improved mental health literacy, and provide access to therapeutic resources. Furthermore, we are exploring the potential of artificial intelligence to enhance diagnostic accuracy and access to evidence-based treatments. Third, we are collaborating with private, academic, and non-governmental organizations to address children and young people's mental health. Such collaboration is vital for dispelling stigma and ensuring high-quality mental health services. Fourth, we invest in overcoming stigma. This includes, among others, the launch of the award-winning National Mental Health Helpline in April 2020, initially conceived in a response to COVID-19. It has evolved into a primary avenue for individuals seeking mental health services in Qatar. Finally, education and awareness. A cornerstone of our strategy is education and the promotion of mental health awareness in schools. In addition to our ongoing efforts within Qatar, we are acutely aware of the broader impacts of the global crisis on mental health, particularly in conflict zones. The current tragic war in Gaza has exacerbated the mental health challenges faced by children, youth, and families in the region. In conclusion, the State of Qatar is dedicated to advancing the mental health of children and young people, and we look forward to hosting the next Global Mental Health Summit in Qatar next year. We are committed to building a future where mental health is recognized and supported as a fundamental aspect of overall health. I thank you, Mr. Chair.
Thank you very much. And as we move forward and give the floor to other delegations, I would kindly ask those who want to intervene to press their microphones. I will try to spot you and try to have a very, active and lively conversation. I now give the floor to the distinguished representative of Canada, Ambassador Arbeiter. You have the floor, please.
Thank you very much. I'll try to be lively and active since you just put the challenge out there. Thank you so much to Romania for putting this together, to all of the co-sponsors, to Dr. Solomon, to Dr. Kestel, for really, giving us a good sense of how this impacts absolutely everyone. I, alongside my colleagues from Bahrain and from Belgium and from Ecuador, have had the real privilege to co-chair the group of Friends of Mental Health here at the UN for the past few years. And we have been exposed to tremendous stories from all parts of the world about tremendous initiatives that are being taken to address this issue for youth, for peacekeepers, for peace builders, how to confront issues that emerge in social media or on the internet, all of the areas that both of you covered. We got to learn about the first ever UN strategy for mental health to address the needs of its own kind of workforce. And each of these opportunities has really helped us, I think, support our capitals in taking better decisions. And so I'm really grateful for the amount of awareness that has increased across the UN system. Of course, we're not alone, and I should acknowledge Dr. Judy Kuryansky, sitting here as well, who's been bringing these issues to the UN for many, many years. I should also recognize Mexico's efforts this past year to bring the first ever resolution on mental health to the UN. This is an area where we should all let 1,000 flowers bloom all the time. Because the truth is, while the issues are ubiquitous, there is no blueprint that we can all point to for an effective strategy at scale. There are wonderful initiatives that have had results, but none of them have been successful, to my knowledge, at either a global or a state or a municipal or a subnational level. And I think we can all continue to learn from each other. So and the same is true, of course, for Canada. We have devoted more resources because the demand is there and there is a requirement, absolutely, but we certainly have our fair share of challenges, particularly with vulnerable communities and with Indigenous peoples in Canada. I did want to point to a couple of projects that I think are really interesting and that I'm proud of. In the first instance, we launched a few years ago a school health grant for youth. These are small projects. It's $1,500, and we do 100 a year. But the students themselves have to apply for the funding. they have to design the project, and they have to deliver the project. And so in the first instance, there is an accountability and ownership and a proximity to the issues that the students can then think through, put together, and then deliver in a way that resonates for them. And while, again, it's not huge amounts of money, the impact for those that have been involved in that has been tremendous. They have been focused on reducing stigma and building that community cohesion that I think both of you spoke of so eloquently. We also have a mental health promotion innovation fund, which is really focused on social connectedness and understanding the social determinants of health as well, and looking again at the community aspects focused on youth as well. And most recently, it's been 3 years now that we actually have a dedicated minister at the federal level for mental health and addictions, and part of her mandate is championing equitable access to mental health. Because there's one thing to have certain programs, if only a smaller segment of your population can access them, you're really not meeting your obligation, frankly, as democratically elected officials. So let me just stop there. I really look forward to hearing all of the other initiatives being taken forward, not only by our friends from Qatar, who are, thank you for hosting next year, but also from other partners around the room, because I think we can all learn from each other and hopefully achieve the kind of policy change that you were pushing us to undertake. Thanks again to Romania. Un grand merci à tous.
Thank you very much, Richard. And I want to thank all the co-organizers that were part of this effort. I mean, it's a bit unfair that I'm sitting here as Romania, but the work has been facilitated by all of our colleagues from the 6 organizing missions. I take advantage that Alicia is next to you, so I will give the floor to Mexico. And we've been referencing the resolution adopted in the General Assembly last year, which is very much important, focusing on mental health in general. And we want to take it and break it down now towards the mental health of children and youth. So Alicia, please, you have the floor.
Thank you very much, and Mexico is really, really very proud to co-sponsor this very timely event. And I really want to say thank you as well to Canada, Indonesia, Kuwait, Qatar, and Romania, as well as WHO, UNICEF, and the UN Youth Office. In particular, we believe that this is a very timely and important event because we really want to show the world that the UN cares about mental health of all youngsters and youth people outside the United Nations. And that is a very important message. I really want to say as well that never again should the body be treated without treating the soul. And for that, I really want to say thank you for the testimonials, for the initiatives, the information that has been given so far. We define mental health as the physical, mental, and social well-being that people have to recognize their abilities and develop them when facing daily stress. Mental health is determined by the interaction of individuals with society and linked to the full exercise of their human rights. As we have heard here today, currently around 20% of the world's children and young people have a diagnosed mental health condition, and I should say in particular after COVID, the impact of COVID has been tremendous, particularly on young children, with suicide being a major cause of death among youth, as we have heard this morning. In the case of my country, Mexico, depression is the mental health condition that most impacts Mexicans, and adolescents are the population most affected. We still have much work to do. In Mexico, we know that 71% of adolescents present depressive symptoms. In May 2022, we reformed our general law on health in order to make mental health and the prevention of addictions a priority within health policies. According to this law, mental health must be provided in accordance with the provisions of our Constitution and international treaties on human rights. In this regard, the state now guarantees universal and equitable access to mental health and addiction care for everyone in our country. The Mexican model of mental health and addiction includes not only the well-being of Mexicans, but also of migrants As you know, we've been receiving thousands and thousands of migrants on a daily basis, many of them children and adolescents who cross our territory and who require these services. Mexico today has a wide network of care services at the primary care level. It includes 341 community centers and more than 142,000 medical and paramedical personnel who have received training and in mental health and psychosocial support. And we aim in this regard to reduce stigma so adolescents and young people seek help when they need it. Stigma is a very important issue that we should tackle at the very beginning. The mental health resolution Mexico presented at the General Assembly last year represents an effort for international cooperation and strengthening of multilateralism that not only seeks to promote and improve mental health services as an essential component of universal health coverage, but also towards adopting prevention strategies to address depression and suicide, in particular among adolescents. All of these actions exemplify clear determinations, not just on the part of Mexico, but of all UN member states towards efforts of prevention, early detection, and care, while raising awareness and reducing stigma for accessing mental health and psychosocial support services. Let me conclude again by saying, never again should the body be treated without treating the soul. Mental health is intrinsically linked to physical health, and we must care for it as such every single day of our lives. Thank you very much.
Thank you very much, Alicia. And I move towards our partners from Indonesia now, and I give the floor to the distinguished colleague and friend, the Deputy Permanent Representative. You have the floor, please.
Thank you very much, Ambassador Fairuta, and allow me to thank Professor Solomon and Dr. Castell for their passionate and insightful presentations. It is truly encouraging to learn that we all share the same understanding on the fundamental importance of mental health for children and youth. And as has been stated by many before me, collective commitment is indeed needed, and it must be done first and foremost through creating a conducive and safe environment for children and youth to grow up. A conducive and safe environment must start from the society and from the family. And by creating a safe and open space to talk about mental health without prejudice, we can also eradicate stigmas that would enable our children and youth to express themselves. We believe the underlying point is that children's and youth mental health is not a luxury, it is not an afterthought, but it is a must. So this requires a paradigm shift. Mental health of children and youth must no longer be seen as an add-on to existing commitments on children and youth development. It has to be mainstream as we plan, implement, and evaluate development policy. We must no longer see it as additional burden, instead as an investment for resilient, inclusive, and progressive future. Towards this end, we believe that all governments must do massive awareness raising on the importance of children's and youth mental wellness in all sectors to create public discourse and allow people to start recognizing the importance of mental wellness for children and youth. For Indonesia, children and youth mental health have become an integral part of our development strategy. Mental health has been covered by our BPJS National Universal Health Insurance System, and it has also been mainstream in our forthcoming long-term national development planning 2025-2045. Let us all ensure that our children's and youth mental health is not underlooked to ensure the quality of the future generations. Thank you.
And I thank you very much. And we continue with our partners from the state of Kuwait. And I would like to give the floor to the Deputy Permanent Representative, Mr. Alannazir. You have the floor.
Thank you, Ambassador. First of all, thank you, Ambassador, for spearheading this event. I'd like to thank the co-hosts and the co-sponsors for joining this event. Doctor, I'd like to commend the work of the WHO for your very essential work and Professor, I would like to really thank you for your very inspiring statement. If I had the opportunity, I would give you my time so you can continue yours. With that being said, honorable delegates, esteemed guests, it is with profound sense of responsibility that we convene today at this pivotal event. Mental health of children and adolescents. How can we do better? Mental health is the bedrock of human potential, the cornerstone upon which we build our dreams, ambitions, and the resilience to face life's adversities. It is a universal right, critical at every stage of life, but imperative during the formative years of childhood and adolescence. The data before us is a clear call for action. Half of the mental health conditions start before the age of 14, shaping the trajectory of lives and the fabric of our societies. The sheer scale and complexity of mental and neurodevelopmental conditions among our youth demand a collective and comprehensive response. Yet, as we stand united today, we must acknowledge a troubling dichotomy. The growing awareness of these challenges has not been matched by an equivalent amplification of resources, services, and support for the young among us. As we embark upon our discussions today, let us be guided by the objectives laid out with clear intention: to amplify awareness, to share evidence, to demonstrate best practices, and to engage every level of society in the pursuit of better mental health for children and adolescents. Our shared humanity obliges us to ensure that mental health does not remain the silent specter in the room, but rather a beacon of hope that guides our policies and practices. The State of Kuwait is committed to advancing mental health care and child protection through comprehensive legislation and programs. In 2019, we introduced a mental health law that extends beyond mere treatment, encompassing reformation and rehabilitation. This law empowers the Ministry of Health to endorse the creation of patient rehabilitation centers and to grant licenses to private shelters dedicated to supporting mental health patients. Furthermore, the establishment of the Mental Health Coordinating Council, comprises 11 members, marks a significant step towards policy development for mental health patient rights. In 2016, we launched the Kuwait National Child Protection Program, a robust initiative to shield children and adolescents from abuse and neglect. This program enforces laws and offers a framework for social and therapeutic rehabilitation services, ensuring that vulnerable children receive the necessary support, moral guidance, and social counseling. Additionally, our government has established an anonymous national child protection hotline aligned with the Kuwait's Child Rights 21 of the year 2015. This hotline serves as a conduit for investigating claims of child abuse and neglect across the 6 districts of Kuwait. The Child Protection Center, under the auspices of the Supreme Council of Family Affairs, was inaugurated to handle complaints regarding children in jeopardy as defined by Article 76 of the Child's Rights Law. The center is also tasked with conducting comprehensive assessment of children's welfare and implementing the required measures for their protection. Moreover, we maintain a confidential registry documenting all instances of harm to children. For children placed in protective care, the Child Protection Center provides health and psychological treatment and extends rehabilitation services to the affected family members. The Child Protection Office of the Ministry of Health is instrumental in managing abuse reports, conducting thorough evaluations by multidisciplinary teams, and facilitating the necessary medical, psychological, and social interventions. Efforts are ongoing to develop a family protection manual and guidelines for mental health, spearheaded by the General Secretariat of the Supreme Court of Family Affairs. Together, these measures reaffirm Kuwait's dedication to fostering a safe and supportive environment for all children and adolescents. In closing, As we look forward to the 4th United Nations High-Level Meeting for Non-Communicable Diseases, let us reflect on the progress made and the path that lies ahead. The insights shared and the commitments renewed today are more than just a response to an urgent health crisis. They are an investment in the world's collective future. By aligning our efforts with the needs and rights of children and adolescents, we do not just better their chances of leading fulfilling lives, we fortify the very foundations of global health and development. Thank you.
Thank you very much. And I can see we have a number of requests for the floor, and I'm going to juggle a bit with the requests. I want to take advantage of the presence of some of you in the room. I'm not going to mention it now, but before you leave, I want to ask you something. I want to give the floor now to one of the strong advocates for this topic that has been working with us very closely. It's the Ambassador of South Africa. I'm grateful not only for your presence, but also for the conversations we've been having so far, and also gives me confidence in how we are going to approach the issue as we look forward. So, dear Matu, please, you have the floor.
Thank you very much, Cornel and Excellencies, dear colleagues. Good afternoon. And let me seriously appreciate you organizing this meeting together with the co-sponsors. I think it is important at this point in time. And I also want to appreciate the inputs that we have received from Andrew Solomon and Deborah Kestel. Andrew, your input was so complete. The stories that you shared with us will remain with us. Nicola's story, I will remember that, what it means for young people, what it means when you don't think comprehensively about providing services, about the cost of services, and about denying services from a human rights perspective. And I think for Deborah, just those 4 succinct points that you made for us to think about as we look at this issue. A number of points have been shared by colleagues that have already made inputs. And I just want to say, when we think about conflict-affected areas, and the example of Ukraine and Gaza has been made, we need to think seriously about what that means for our future, for the future of young people in these affected areas. The points around ensuring that partnerships, that there's integrated approach as we look at our health policies and our strategies, and that actually there's a cheaper way of providing this mental health services to young people and communities. So I really appreciated what has been said already, and don't necessarily want to make a statement, but to appreciate what has been said. But the question in my mind now, when I look at South Africa and what we have policy guidelines for dealing with mental health issues for young people and adolescents. We also have a strategy, in a youth strategy, we have a section that looks at mental health. But I'm left feeling that there possibly is room, Cornel, for something that can bring all, and I think that's the point that Canada was making, that can bring all of these into a much more scaled up, as you said, a globalized, whether it's a framework that helps our member states to deal with this particular issue. And that's a question that I'd like to pose to the panel and to our partners, WHO, UNICEF, to say, is there room for us to pull everything that we know now and that we agree into an instrument that can assist member states, that member states can sign up to and assist us in dealing with the issue of mental health for children and for adolescents? Otherwise, I found the input so far from our keynote speakers, from you, Cornel, and for those member states that have already talked very, very useful, and I think it's an issue that needs our attention even more today, especially with the digital technologies that are there and the impact of on young people. Thank you very much for this initiative.
Thank you very much, Mathu. Please hold your thoughts on the questions. We'll address that, but we will get a few more inputs. I know we have with us here someone that is very relevant for one issue that also Professor Solomon mentioned, which is technology. And I know that we have with us in the room the Deputy Secretary General of the International Telecommunication Union, but I also know that you're about to leave. But before you leave, I want to ask you to share your thoughts about how do you see exactly this, the challenges and opportunities of technology. As I mentioned, the two important issues for the younger generation are technology and mental health. And how would you see that, and what is the kind of thought that you would like to share with us here for this meeting? Please. Sorry for putting you on the spot.
Thank you very much. You see, so sometimes technology takes time to work, but indeed, thank you very much, Ambassador. And I think it's always a pleasure to be put on a spot on this important topic. And I think also have a good segue here from the Ambassador from South Africa mentioning digital technology as an important aspect of these conversations. And thank you for that. And indeed, with increased connectivity, children and young people have more avenues for communication, social interaction that enables them to realize their rights online, have better access to education, information, participation. However, we also need to acknowledge the risks and challenges that brings with it. So, indeed, some of those challenges and risks include risks to privacy, cyberbullying, misinformation, violent content, online harassment. And our colleagues from UNICEF, in their numbers, they're actually saying that 1 in 5 children have skipped school because of cyberbullying. And this indeed is a growing issue. So this poses significant challenges, of course, for online platforms as well that struggle to address them effectively. The rapid increase in children going online, with one child going online every half a second, often without supervision and relevant skills, brings more of these risks, which have shown to have detrimental effects on the mental health on children and adolescents. And these risks, of course, can profoundly impact the mental health of children and adolescents due to their potential for re-victimization, continuous exposure to violence without safe spaces or protection, and often in conjunction with other forms of violence. The impact can manifest psychologically or physically, with misinformation and health posing additional risks to children's well-being. Indeed, the most pressing threat to children today is also the alarming growth of online child sexual exploitation and abuse. Shockingly, the number of reports containing child sexual abuse imagery has risen to over 250,000 globally, underscoring the urgent need for coordinated response to protect our children from this escalating threat. So what are we doing together with our partners? So through our collaborative efforts, including with national authorities such as, for example, Saudi Arabia's National Cybersecurity Authority, ITU has launched a global program aimed at creating a safe, empowering cyber environment for children. Our approach encompasses policy development, capacity building, knowledge sharing, and international collaboration to address the multifaceted challenges of child online protection. We have developed and translated the Child Online Protection Guidelines into over 25 languages, delivered Train the Trainers program to educators, developed audience-specific online trainings on child online protection utilized by over 15,000 children, parents, caretakers, policymakers, as well as ICT professionals. Through that, we strengthen national frameworks in 4 countries influencing national policies and regulations. There is also a positive side in this context of online participation, and we observed the rise of children seeking help through online means when at risk of experiencing violence. Technology offers easy access to information and resources related to mental health support and education, empowering young people to seek help and support when needed and offer support to their peers as well. In recognition of the importance of child participation and ensuring effective online protection, ITU and the Office of the Special Representative of the Secretary General on Violence Against Children jointly launched the Protection Through Online Participation Initiative in 2021. This collaboration aims to pioneer a global effort to enhance child protection services online through intersectoral collaboration and knowledge sharing, and has played a crucial role in facilitating online support to children and fostering collaboration among various stakeholders. Partners, and we have over 30 of them from academia, civil societies, and industry, and they include also UNICEF, UN Office for Secretary General's Envoy on Youth, UNODC, Child Helpline International, as well as multiple private sector partners work together with us on this. Our past achievements include data collection from 100 countries, mapping child helplines using the internet for counseling, and collecting learnings from tech platforms to bridge protection services with users. Moving forward, we plan to focus on evidence collection, AI-driven solutions, as well as releasing global recommendations to improve online support services for children and youth. So, ladies and gentlemen, digital technologies have enormous potential to empower youth and children through information, education, jobs, activism, but we need to ensure then that we also understand and manage the risks as well, especially the mental health impacts, so that negative effects do not overshadow the positive transformative power of digital technologies. And thank you very much for giving this opportunity. Thank you.
Thank you very much. We're going to juggle again, and I want to go back to one of the supporters of this topic, and we would not be able to do that without the UN Office, Youth Office, UN Youth Office. The head of the UN Youth Office could not be here with us in person, but he recorded a message, and I would like to invite you to watch it, because the UN Office, Youth Office actually is also providing this connection that we badly need in our work. The Youth Office and UNICEF, and we're going to hear from the UNICEF afterwards as well, which is also one important part of our efforts here. So we'll play this message from Mr. Felipe Polier, who is the head of the UN Youth Office, has been an advocate for a long time on youth issues, and mental health is one of the important topics that they are looking at. So if we could play the video, please.
Good morning. My name is Felipe Polier, and I'm the United Nations Assistant Secretary General for Youth Affairs. I lead the newly established UN Youth Office, and it is a pleasure for us to co-sponsor this event together with the permanent missions of Romania, Mexico, Canada, Qatar, Kuwait, and Indonesia to the United Nations, as well as the World Health Organization and UNICEF. This conversation that we are having today is very timely. We live in a world with 1.9 billion young people. Half of the world's population is under 30 years old, 90% of which live in developing countries. Despite their incredible resilience, young people today are faced with a world with multiple crises and increased uncertainty. Conflict, climate change, lack of access to education, decent jobs, or quality healthcare. At the same time, youth is a key transition in life, from childhood to adulthood, from dependence to independence. This transition comes with its own unique challenges, amplified by the profound social isolation brought about by the COVID-19 pandemic. It is estimated that globally, 1 in 7 young people experience some mental health condition, yet this is rarely diagnosed or addressed. Mental health challenges are neither unusual nor unexpected. They are, however, the leading cause of disability and adverse life outcomes in young people. This is especially true for young people left behind, like those in conflict settings, in refugee camps, or in rural areas, with no access to healthcare. Mental health is a key component to our ability to not only survive, but to thrive. It is also defined by multiple factors. The response needs to be shaped accordingly and take place at different levels, from families to communities to systems in which young people live, operate, and interact. This is where it is our responsibility to intervene, to listen to young people, and to act in their support. And above all, to work with them as equal partners as we address these challenges. This event brings together policymakers, academia, decision makers, and young people in a joint effort to understand and to act upon mental health. I hope that we can jointly leave this session today with a commitment towards creating an environment in which every young person, everywhere, has someone to turn for psychosocial support. A world where national policies and investments are multisectorial and sensitive to young people's mental health needs. A world where mental health and psychosocial support services for young people are expanded, accessible, stigma-free, and trustworthy. And most importantly, a world where young people deliver the change and solutions they need for their mental well-being. A world where young people are treated as partners and not just as beneficiaries of aid. I look forward to continuing this partnership and this conversation. Thank you very much.
And because it's an important message, and we're very glad because Mr. Pollier was appointed in December last year, right? So that's important. We have the UN Youth Office colleagues present here, and of course we are looking forward on how to bring this matter forward. But let's dovetail that with a contribution from UNICEF. It is one also of our partners in organizing this event, and also a partner for the long road. So, Mrs. Thompson, you have the floor, please. Ferguson, I apologize.
Thank you. Ambassadors, esteemed speakers, delegates, and colleagues, it is with great appreciation that we acknowledge the permanent mission of Romania and our fellow co-hosts this morning for your dedication to child and youth mental health. Your efforts in organizing this critical event reflect a shared vision for a healthier, more resilient future for our youngest generations. As we have heard already this morning, when we ignore children's right to good mental health and well-being, we undermine their enjoyment of all other rights, including their capacity to learn, develop, build meaningful relationships, and contribute to the world. When we ignore the mental health of parents and caregivers, we fail to support them to nurture and care for their children to the best of their ability. Acknowledging this urgency, UNICEF has made mental health an organizational priority, and we are working alongside governments and partners to accelerate the development and implementation of policies, programs, and services to support child and youth mental health. We are proud to have reached over 38.9 million children, adolescents, and caregivers across 130 countries last year, employing a multi-sectoral approach to address the comprehensive needs influenced by a range of psychosocial factors. Furthermore, as Deborah has mentioned, through UNICEF and WHO's joint program, we are working together to strengthen mental health systems and services across 13 countries initially. Last year, we witnessed global recognition of mental health significance through the General Assembly resolution adopted in June. We welcome the particular attention to child and youth mental health in this landmark text. The increasing emphasis on child and youth mental health in other global dialogues has also been a source of great encouragement, particularly as we reflect on the strides made during last year's Global Mental Health Summit hosted by the government of Argentina. This summit marked a significant shift as we saw the nuanced needs of young people incorporated in targeted recommendations in the final report and through robust youth engagement throughout. And we look forward to building on this at the forthcoming summit hosted by Qatar and other important dialogues this year. This was a really powerful reminder of the indispensable role of active participation of children, youth, and caregivers in shaping mental health frameworks. And it's on that note that I'd just like to pass now to Louisa for the second half of this intervention to share her critical reflections as a youth advocate working on mental health. Thank you.
Thank you so much, everyone. I'm Luisa Villanova. I'm an education and mental health activist from Brazil. And I come from a country where 1 in every 6 Brazilian children between the ages of 10 and 19 live with poor mental health. I have seen friends struggle not only with their mental health, but with the stigma surrounding it. At age 11, anxiety became a frequent companion. And I remember thinking, just breathe in, breathe out. And without being able to name that feeling, my mental health was tested amid intense bullying, as we previously heard a little bit about, and economic hardship. I was fortunate enough to have a mother who realized that the symptoms weren't typical or weren't something that every child has to go through, and recognizing it was the first step. Although I was assisted by my church's volunteer psychological support program, I am an exception and certainly not the rule. Frequently, when we discuss mental health interventions, we focus on the medical approach to it. However, my experience as an advocate has shown me that the most powerful interventions have to occur a lot of times inside the school and meet children where they are. In the span of 1 generation, my parents protected me from sexual abuse and the child work that their parents have been subjected to. And the only fact that I was in school was an important reason why I had a different story. Teachers and school staff are uniquely positioned to identify when their students are suffering from mental health conditions, but schools as institutions are the most powerful space for mental health prevention. And that's why I founded Tocando em Frente, which is an NGO that focuses on bringing social-emotional learning to school spaces. And our intervention brings stories of inspirations and the social-emotional learning curriculum that ensures that every child is faced with the opportunity to learn about their own feelings and move forward with the right to dream. With a team of over 90 volunteers aged 13 to 25, we visit public schools all over the country to implement a gamified learning journey where we have lesson plans that are going to bring different social-emotional learning skills. In order to continue that work, we really want to keep ensuring that every student have their mental well-being at the front of their educational journey. And here I want to share a little bit of 3 guiding principles that I believe could maybe frame our discussions moving forward. The first one is a youth-led approach, as we heard previously. We realize in our work that results in a cathartic sharing, where we have a unique bonding between young volunteers and the students, and that ensures that we are actually creating a safety net for them. The second one is that it must be community-based. Stigma is the biggest catalyst for young people's extreme mental health conditions, and only those who are from that community are truly able to understand the challenges that they are facing that come from being from there. And the last part, as Dr. Kestel previously mentioned, it's really key that we have a school-based approach. Schools are at the center of a young person's life, and it's where they spend most of their time there. And ensuring that we have a social-emotional learning curriculum and are prepared to support in the initial screening process of students with mental health conditions is the most powerful strategy to find the silent epidemic. It's a hard task, and we heard a lot of hard stories today of people who have gone through those challenges, and I'm sure many of us have experienced that too. And in the moments when I am faced with all those really, really big challenges, I like to think back to my own catalog of resilient memories, and I invite you all to do the same. And just sharing one story that is present in my catalog that helped me find strength to continue fighting for all of this. Marcos Paulo is a kid that we worked with back in the first year of our project. He was suffering because he lost his father for drug addiction, and his mother was faced with extreme poverty moving forward. And in the last activity in his school, I'm really tall, so he hugged me and said, "Lou, because you believe in me, I decided to be a lawyer." And I feel like regardless of the obstacles, the children that we are all thinking about are able to show to us that the right to dream and to keep living has an unbelievable power for mental health prevention. So thank you so much.
Thank you very much. Very powerful, and thank you for being so motivated. It also motivates us. I want to. There are some of us here in the meeting room that came a long way to be present with us, and I want to acknowledge that important effort. And I want to give the floor to Katrin Götzke from the International Foundation and Research on Hope. Katrin, thank you very much for coming. I know that you've been a very strong advocate, and looking forward to hearing from you. One logistical announcement. We diplomats, we like long meetings, but we wanted to stop short at 12 o'clock. But given the interest and the vitality in the room, we will continue for another half an hour. 25 minutes already now. So, Katrin, please, you have the floor.
Perfect. Thank you. Thank you so much for hosting this critical meeting. It's a critical time for youth mental health. As you mentioned, my name is Katrin Götzke. I'm a representative at the United Nations for the World Federation for Mental Health, and I founded a nonprofit called IFRA, the International Foundation for Research and Education. Started out as depression and rebranded to hope based on my story. I'm also an entrepreneur and a businesswoman, having successfully run the first nationwide cause marketing campaign for mental health. I come also with lived experience. My dad died by suicide when I was 18 years old. He was a successful businessman. He was a great, great dad. I then, in my 20s, had my own suicide attempt, struggled at a very young age with addiction, anxiety, depression, ADHD, PTSD. Yet this is what I know to be true. What I believe I struggled with fundamentally and what my dad struggled with was hopelessness. And, we were never taught what hopelessness is and how to get to hope. So I'd like to suggest hope as a strategy for mental health. As it's been clearly established through experts like my mentor, Dr. Myron Belfer, that hopelessness is the primary symptom of depression and a key symptom of anxiety. Hopelessness is predictive of all risky behaviors in youth, violence, partner violence, addiction, self-harm, that hopelessness is the single consistent predictor of suicide. And 10 years ago, suicide prevention focused primarily on restricting access to means and 800 numbers, suicide hotlines. And while those are critical, I knew it was never going to save me or my dad. And so I set out to figure out how to teach hope. We were able to prove out our theory that hope is a teachable skill, and our program, Hopeful Minds, was recognized as an innovation by the World Bank. And we've been able to show that as you increase hope, symptoms for anxiety and depression decrease. We all experience moments of hopelessness, every one of us, and it's time to normalize that and ensure we all know how to manage those moments and get back to hope. In adult interventions, there's a 4-to-1 return on investment for mental health interventions. We know for youth, it's a 23-to-1 return on investment or greater. So it makes good business sense. Hope is a protective factor for anxiety and depression. I spoke here at the UN in 2015 on International Day of Persons with Disabilities to advocate getting mental health included in the Sustainable Development Goals. And you did, and I want to thank you for that. Today, I'm asking you to prioritize mental health and to consider passing a resolution for an International Day of Hope at the United Nations, where we elevate science stories and strategies for hope, so that we ensure all around the world know how to measure their hope and are equipped with skills to increase their hope, especially our children. As hope is not just important for mental health, hope impacts all SDGs: poverty, education, gender equality, clean water. We cannot achieve these goals without hope. Today, one of my supporters, Chef Grace Ramirez, is here with us over there. Chef Grace is the global ambassador for the World Central Kitchen, where yesterday 7 of her team members were killed in Gaza. They died delivering aid. And I ask, what kind of world are we leaving for our children? I really believe it's time that we start working together. We start working to find our way back to hope. Thank you.
Thank you very much, Catherine, and thank you for your advocacy. And that's a concept that I think we should all take with us. I take from what Professor Solomon was saying, vitality is important, hope is important, and is part of the whole conversation. I would like now to juggle again with the list of speakers, and please bear with me. We still have 20 minutes, so let's be as concise as possible. But I want to go to one of our fellow ambassadors, the ambassador of Grenada. Che, do I see it right? Are you there? You are. So, Che, please, you have the floor.
Thank you so very much, Cornell. Such a powerful interventions that have been made this morning. Excellencies, colleagues, it's a pleasure for me to be here and to represent Grenada. 5 points by way of comment and 3 country experiences. The intervention by my friend from UNICEF / Brazil has been such a powerful intervention, and I highlighted some of the points that you've made that are almost identical to the points that I'm about to make. Point number 1 has to do with the issue of normalizing mental health care, and I speak in the context of Grenada. If someone has an injury to their arm, you see them walking around with a sling or a cast. If you've broken your foot, you see that fellow walking with a cast or a brace. If you've had an injury to your neck, you see them with a neck brace. But when we have injuries and we have challenges with respect to our mental faculties, that's not an easily identifiable concern or something that we can point to. And how do you fix that? How do you respond to that, particularly if and when it affects our youth, as my friend from Brazil has shared? So the issue of and oftentimes youth have been left because they're young people. They're still trying to figure out and appreciate and understand some of the issues that they're going through, even with their own bodies. Issues of mental health are things that they're left to figure out on their own, which leads to my 3rd point, and that's the issue of, again, one of the interventions mentioned it, the introduction of mental health into our school curricula. In Grenada's case, we have very good teachers who, on their own accord and at their good discretion, may teach and may have certain sessions on mental health. But to say that it is not specifically a mandated item on the curricula for our students to learn. We have health and family life types of content. Our students are aware of their different parts. I remember still drawing a grasshopper and drawing a caterpillar in biology class, but in terms of the content specific to what is happening within your mind, the psychology and the psychiatry of the operation of your mind, is the kind of attention and focus that we need to give more content to in terms of our school curricula. Point number 4 has to do, and it's been mentioned multiple times by other speakers, the issue with respect to stigma. We've seen in our experience, particularly with our boys and our young men, they become stigmatized with respect to their mental health issues. The idea of going to a healthcare facility, going to the psychiatric facility, or going to your doctor to get medicine, to, as we call it, to get quote-unquote your shots, they don't do it, or they hide to do it, and they're ridiculed, and then there was a conversation or intervention that talked about cyberbullying and that kind of thing. So the stigma that is associated with seeking help and seeking mental health services, particularly with our young men, particularly with our boys, because the culture says that boys aren't supposed to cry. Young men aren't supposed to show up the emotions. They're supposed to stand strong, stand tall. And it's an emotional response or behavior that is left for the girls or for the females. So that issue of destigmatizing mental health care and mental health issues is something that we have to address. And finally, point number 5 has to do with, of course, with government funding. And I suppose perhaps it's I dare say, a challenge for us all. A lot of focus is given to agriculture, a lot of focus is given to sports and athletics, a lot of focus is given to many other developmental issues that is a perennial challenge for all our countries, and particularly our small island states. But in terms of getting the appropriate funding and focus on mental health needs, there's always more that we can do. And finally, the 3 national experiences. In Grenada's case, what my government has done in the last 15 months or so is to roll out the presence of having counselors at our high school or our secondary schools. The intention here is to give more focus, more personalized and central attention at each particular high school where there is a counselor/mental health professional who is available to be able to meet the needs of our youth. And by extension, the second experience also has to do with our primary care and our primary school level. We also have counselors and healthcare practitioners who have responsibility for the districts of our primary schools. And finally, we have, over the last year in Grenada, we have actually launched a new ministry, the Ministry of Mental Health, Wellness, and Religious Affairs, with special focus and responsibility with our psychiatric hospitals. So we actually now have a line ministry that is specifically focused on the mental health of anyone, really, but we also have a minister who's designated with the responsibility of dealing and treating with mental health matters. And with that, this is a very powerful discussion and session that we did not want to miss. And when I listen to the interventions that have been made on the floor by my other colleagues and our friends, it just reminds us how important this issue is and how much we all need to be advocates on matters pertaining to mental health, particularly when it concerns our most vulnerable members of our society, and that is our youth. Thank you, Chair.
Thank you very much, Chair. We have a special visitor from Poland, Mr. Marek Kamiński, who is the president of the Kamiński Foundation, focused on mental health in youth and children. So, Mr. Kamiński, thank you very much for coming. Please, you have the floor.
Yes, thank you very much. It's a great honor to be with you, and thank you, Romania and Professor Andrew Salomon, for sharing the great ideas and all the representatives. Myself, I am philosopher, poet, explorer, and physicist, but more doer as thinker. And the mental resilience and mental health was a key factor for me reaching the North Pole or South Pole, being in the extreme conditions to survive. But now I think the mental health and resilience is the key factor for humanity, especially for young children, to survive. And I agree totally with the words of Mr. Andrew Salomon, that children are lost in the nothingness of outside world and the lack of purpose, and for many of them, lack of meaning of the life. So many years ago, I met a young boy, 13 years boy, who lost arm and leg, and he was thinking about suicide and was in depression, and I organized for him and with a team of scientists expedition to the North Pole and South Pole, and we developed a special program, special mental program to enforce him, and we did it. He was the youngest person to reach the North Pole and South Pole in the age of 15 years old, and on basis of this experience, we, as the foundation, we developed, I understood also from the data of the World Health Organization that resilience, mental health will be the problem number one and for humanity, and especially for young people. So we developed the special program, Life Plan Academy, basis on the 5 steps method, like about defining the goals, planning the way to the goal, that the way is more important than the goal only, and about dealing with the failures and successes also, and about knowing yourself. because I think that nowadays the young people, they know more about outside world than about themselves. So the programs that focus on dealing with emotions, with failures, with trauma, with post-traumatic stress disorder are very important. So we develop the workshops, application, and we work in Rwanda, Kenya also. We work with Ukrainian children in Poland. We want to develop the global resilience project and work over the world. I had many lectures in Japan, Jakarta, many countries, and there is always the same problem. There is a lack of resources, there is a lack of programs, and the problem is shifted for the future, but we cannot wait. So we are very open to work as the partners with Brazil or Mexico, Bahrain, and Qatar, and really great to be here. And I hope that we can build a partnership for the future mental health programs that works. Thank you very much.
Thank you very much. Let's go now to Dr. Judy Kuryansky. Then we go to Ukraine, and then we'll exhaust the list of speakers before we end up, and also we'll give a chance to the panelists to answer and to comment. Dr. Kuryansky, please.
Thank you so much, Ambassador. And thank you, Richard, for that kind acknowledgement, and hats off to you, too, for everything you've done since the day you arrived here. Over all those years, it's amazing to see the countries from all these regions in support of mental health now. So that is really significant. My question is really a challenge and also a way forward from two hats. My first hat is on behalf of the mission of Sierra Leone as their advisor, and to ask, how are we going to move these policies, the UN resolutions, the GA resolutions that have already been put in place? That the PGA just said we need the governments together with civil society to move this forward. So the first one has to do with the First Lady of Sierra Leone and Nigeria passing the resolution on access to justice for survivors of violence, of sexual violence. So that is really significant because violence and sexual violence plays a role in all these issues that you were talking about as a youth, right? So that's my first point. What are we going to do for the next steps of that resolution and the companion resolution, which is zero tolerance for violence against children, relevant to today? The second one has to do with where are we going next with the Mexico resolution that we all recognize is incredibly important. So I'd like to hear Mexico and the rest of us talk about where do we bring that policy that is so important. The first one about mental health and psychosocial support, and you, Ambassador Faruda, you know because my students from Columbia came, Teachers College came and visited you and several of the other missions here, and some of these students are here now, to talk about youth and mental health. And that was to support the Mexico resolution. So my question is the next steps for these policies already in place, the GA resolutions, that we collectively work together. I'd love to hear people respond to that.
Thank you. Well, we'll address that matter, probably not today, but of course there is willingness to look at that matter. We had the GA resolution, and I can speak for member states. I mean, as far as we are concerned, we are very much focused on not only on implementing the resolutions already adopted, but also to take it a step further. The very fact that we have an open conversation on mental health in youth and children is important. To be able to speak out. It's part of the, let's say, the steps that we as member states will have to take. But as I said, I don't want to address this just in a rush and superficially. We'll need to have this conversation here at the UN, and we'll also reflect on these exchanges today. Let's go to Ukraine, and then we'll go to Bahrain. Please, Christina, you have the floor.
Thank you, Mr. Chair, and thank you to Romania and all co-sponsors of this important event for organizing it and keeping mental health issue on the UN agenda. We are grateful to our distinguished briefers for your insightful presentations. When addressing mental health of young people, it is essential to look at the impact of wars and armed conflicts, which do have severe consequences on the population, especially children and young people. Allow me in this respect to share a few experience of, concerning my own country, Ukraine, where people do face and address multiple challenges and where the issue of mental health is not underestimated and paid adequate attention to. According to the UNICEF survey through YouReport Ukraine, 73% of young people aged from 14 to 34 in our country require emotional or psychological support. However, only 30% have asked for such help. Research indicates that children and adolescents want to understand their emotions and learn how to handle stressful situations. To address this issue, Ukraine closely cooperates with the WHO, with UNICEF, and other international partners to strengthen community-based mental health services. UNICEF, in partnership with our Ministry of Education and Science of Ukraine, has launched mental health support groups for teenagers and parents whose lives have been devastated by Russian war against Ukraine. First Lady of Ukraine launched the All-Ukrainian Mental Health Program, which is called How Are You? In this initiative aims to establish a quality system of services in the field of psychosocial support and promote culture of mental health in mental health care in the society. The program addresses mental health issues of people of all ages, but also, of course, including children and youth adults. As part of the How Are You program, recommendations on self-help and child help, as well as contacts of mental health hotline, are available on the website, and manual, which is called Mental Health of Children During the War, Advice for Parents and Guardians, which is also available online, provides parents with useful information on how to help their children. We are grateful to WHO for supporting the Coordination Center for Mental Health that acts within the government of Ukraine. Allow me to thank all partners who highlight importance of mental health issue and keep it high on the agenda, helping societies affected by conflicts to address these challenges and help people on the ground. Thank you.
Thank you very much. Well, I hate to do that, but we have to be as concise as possible because I think not only you, but also the speakers will have other engagements. Let's move to Bahrain, Japan, Singapore, and then we have you. So, Bahrain, please.
Thank you, Ambassador. Allow me to start by thanking you and the co-organizers of this event for bringing us together to discuss the important issue of mental health of children and young people. I also thank the President of the General Assembly and the keynote speakers for their valuable insights. As co-chair of the Group of Friends of Mental Health and Wellbeing, alongside Belgium, Canada, Ecuador, Bahrain attaches great importance to strengthening knowledge and promoting action among member states and partners at all levels on mental health, including that of children and young people. In recent years, the mental health agenda has gained increased global attention. The UN and its agencies have scaled up their efforts to address mental health and psychological well-being, yet the situation remains extremely worrying. As has already been mentioned, this is exacerbated by the impact of multiple crises the world is facing that are taking an enormous toll on children and young people, as well as the widespread stigma associated with mental health conditions and the lack of access to resources and services. While digital technologies can increase mental health risks, they can also contribute to better mental health. In this context, it is important to encourage investment in children and young people's mental health across sectors, especially proven interventions in the health, education, and social protection sectors. And such efforts should focus in particular on prevention, early detection, and care. In this phase of accelerated progress towards the Sustainable Development Goals, we agree that more needs to be done for mental health promotion and prevention. The fourth high-level meeting of the UN General Assembly on the prevention and control of non-communicable diseases disease in 2025 will be a valuable opportunity to reaffirm our commitment to the promotion of mental health and well-being. Moreover, in the lead up to the Summit of the Future this year, it is important to continue to highlight mental health and to encourage engagement on this global challenge for future generations. Bahrain will continue to work, including through the Group of Friends of Mental Health and Well-being, with other member states and partners to this end. Thank you.
I thank you very much, and we move now to Japan. Please, sir, you have the floor.
Thank you very much for the floor, and I would like to appreciate the Ambassador of Romania and also the co-sponsors and partners for having these precious meetings. I would like to be very brief on the comment. And as for Japan, we are famous for the low fertility rate, and we are struggling with low birth rate. But even in that situation, last year we have the unprecedented level of suicide by youth, which is over 500 youths only last year. And as Professor Solomon mentioned, we are struggling with hikikomori, which is social withdrawal by youth. And some experts already pointed out that this is a kind of, one part of this is from the mental health issues in their youth age. And we would like to prioritize the comprehensive support from an early stage, encompassing the school education and primary health care, including community health outreach, in addition to child protection and social welfare. And I also would like to point out that one of the advocating countries for UHC, we would like to prioritize mental health in the context of universal health coverage, because we need to overcome the stigma on the mental health problem. But we had better to have the kind of ubiquitous access to mental health care. So we would like to strengthen our mental health care systems, including the access, improvement of the access to the mental health cares in the context of universal health coverage. And thank you very much for the precious event today.
And I thank you all for the patience. I now give the floor to Singapore. Please, you have the floor.
Thank you, Ambassador, and thank you for organizing this platform to share ways in which we can do more. So mental health is growing in importance with the prevalence of mental health disorders rising over the years. In Singapore itself, mental health disorders were one of the top 4 leading causes of disease burden. And we do see also that it's a growing issue among children and young people. Many countries, as we have all shared, have reported increases in mental health conditions among their youths. Last year, for example, the US Surgeon General called the increasing mental health needs of US youth as the defining public health crisis of our time. Even the Nordic countries, which consistently rank high in global happiness and well-being surveys, are reporting rises in youth anxiety, depression, and a variety of mental illnesses. In Singapore, we are not spared from that either. Youths aged 18 to 29 form the largest population of people with poor mental health, according to our 2022 survey. So it's imperative, in fact, to support the mental health and well-being needs of children and young people to achieve their fullest potential. And COVID-19 pandemic brought these challenges to the forefront, which highlights the need to invest and to act now. So in this regard, Singapore has made mental health and well-being a key priority in our national agenda. Last year, we launched a national mental health and well-being strategy, which sets out the concrete plans to plug existing gaps and to strengthen our mental health ecosystem. On the areas in which we can do better, I would like to suggest 3 points. First, promoting mental health and well-being should start early, as many of our speakers have already mentioned. As mental health conditions can manifest early, improving mental health literacy and building mental resilience needs to start at a young age. In this regard, Singapore has introduced mental health education lessons and programs for students going through critical transition years in schools. Youth community mental health teams also help raise mental health awareness and encourage young people to seek help early beyond the school setting. And moving forward, social and emotional development lessons will be introduced in preschools as well. Second, holistic, effective intervention requires multi-sectoral strategies. So I think Dr. Kestel mentioned earlier that mental health interventions extend beyond the health sector and should integrate efforts across sectors like the health, social, and education sectors. and it also requires a whole of government and whole of society approach. Parents, caregivers, educators, and the community also must work together to achieve this aim. So in Singapore, besides deploying more teacher counselors in schools, we are developing more resources for parents to support their children's mental health and well-being needs, and to establish more peer support networks in the community. Beyond policies and programs, a whole of society effort is necessary to change societal attitudes and to destigmatize mental health, as many of us have already mentioned. And finally, I want to highlight a third point, which is that we need to strengthen research to enhance intervention efforts. More work needs to be done to better understand the recent surge in youth mental health issues globally. So identifying the key causal factors and the interplay between these factors will help countries like us to design and implement evidence-based interventions to better help our young people. Singapore is redoubling our efforts to better understand these issues and linking up with researchers from around the world to understand the root causes. We'd like to just reiterate our commitment to achieving SDG Target 3.4, which is to reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment of NCDs and promotion of mental health and well-being. So we look ahead to the 4th high-level meeting of the UN General Assembly on the prevention and control of NCDs in 2025, and let's all redouble our efforts together to have positive change and foster better mental health for our young people. Thank you.
Thank you, Singapore. And last but not least, I will give you the floor, please, to my right.
Thank you. Hi, thank you so much for hosting this event. I feel truly privileged and inspired to be here. My name is Carrie Crease. I am the head of school of a preschool here in New York City. I've been an educator for over 30 years, and today, being amongst all of you, I actually do feel hopeful. I think the idea of an International Day of Hope is critical. I agree with the statement that social emotional learning programs at school are also critical. But one of the things that I think about often is finding the root cause of our challenges. And for me, our teachers are ill-equipped and have been for quite some time to deliver these social emotional learning programs in a way that is authentic, given their own mental well-being too. So it would be, I think, incumbent upon us to find those ways to support our teachers who feel so burdened by how full their plate is. If only we could give them a reason to believe that mental wellness and mental health is the plate. Thank you so much.
Thank you very much. Well, we can discuss about mental health, we can plan, but we cannot delay flights. So Dr. Kestel had to leave. That was a very rich contribution. I would like to give the last word to Professor Solomon. And I'm very grateful for your comments, Professor, please.
I'm very grateful for all of the comments that have been put forward by activists, by ambassadors, by people from so many places in the world, all of whom seem to share a common concern. It's extremely heartening to see that there is this vast movement toward addressing a problem that has become increasingly acute and that seems to be on an upward trajectory of becoming ever more acute. So I want to thank everyone for the things that you've had to say and for the comments that you've made. They've been very uplifting. I won't try to respond to the specific points of what everyone communicated. What I would emphasize is that I think the meeting demonstrates that this is a universal need. As we look at a UN resolution or as we look at any other attempt to forge, as the South African ambassador suggested, an international policy, I think what we have to agree is that there are cultural differences from society to society that need to be acknowledged, and we cannot come up with a single solution that is going to work everywhere. Even within societies, there are enormous cultural differences, and a single solution doesn't work. What I think there is agreement on is what the problem is. And I think what needs to be taken from there is an international understanding that this is an urgent problem, that it is an escalating problem, and that it is an extremely dangerous problem, and that therefore each country needs to come up with its own methods, but within the framework of a larger international agreement, that this requires emphasis that this is actually something that cannot be pushed over to the edges. I think it's extremely important, as a number of people have said, to involve young people themselves in this process. All of us who are supposedly authorities on it can hold forth at great length, but there are certain communications to which young people are more responsive if they come from other young people. And so I think this has to be a cross-generational movement. The United Nations has to provide a template. The young have to be able to respond to it. Different nations have to be able to respond to it. It is possible to create a coherent template. And it is possible then to determine, as we move toward a model in which there is greater funding, what are the programs that will have the most effect. There is very little emphasis in health generally on prevention, and there is often a sense that prevention is ineffective, or indeed just that its results take so long to be demonstrated that it is not worthwhile to pursue. We've heard over and over again today from people in one country after the next that there are strategies, particularly educational strategies, that can be introduced very early on and that can actually forestall a lot of these problems. So on the one hand, this has been rather a bleak meeting with many very dark stories told of high rates of trauma all the way across the world in various circumstances. And on the other hand, I think a very encouraging one, because if the nations of the world are able to unite, then the stigma begins to evaporate. It becomes something, the ambassador from Grenada spoke so eloquently about young men who have a perspective that mental health complaints are somehow socially or morally unacceptable. That begins to change once the discourse opens up. When the policies in countries treat the health that is mental health, or that is, as someone said, the health of the soul, on an equal level with the health of the body, then the stigma disappears, and then the solutions begin to emerge. So I would say not only that the United Nations can formulate solutions, but that the very act on the United Nations part of formulating those solutions is itself the beginning of a solution, because it changes people's attitude toward these problems and allows them to understand their right to help, the importance of help, and the capacity that every country, in fact, has to provide help of one kind or another. Thank you.
And that's a proper way to pose this conversation. I mean, I hope this is not the end of this conversation at the UN. I want to say that, I'm very grateful for your inputs, for the engagement and commitment. And I think that creates a very good avenue for what we can achieve. And I'm very grateful to you, Professor Solomon, for being so eloquent in bringing this matter very close to our desks and policies that we are discussing here at the UN. I'm grateful for the people here in the room, for those who watched online, and I think this remains one of the key objectives that we have, to make sure that we cater for the most important needs of the younger generation, because I think from my point of view, there's an investment in conflict prevention as well, in conflict management, and it's very intrinsically linked with the work of the United Nations. So I appreciate, thank you very much. I thank again my fellow colleagues from the missions for this important support, and we look forward to continuing this conversation. I appreciate it. Thank you.